Assalamu alaikum everyone, my name is Mazin Altalag. I'm here to present nose, larynx and trachea. Now this is a pretty dense lecture, but inshallah with enough practice and enough revision, everything will be fine. So let's begin. Here are the contents. Now for the external structure of the surface of the nose. Now this is pretty simple. It starts with the nasal root, then the dorsum of the nose, dorsum nasi, the apex, and laterally you have the ala. Now the root, it's continuous with the nose, from the nose to the forehead. The dorsum of the nose, it's the biggest part, it's the largest part of the external nose, extends from the root to the apex. The apex, self-explanatory, located at the inferior end. Now the nares, it's the opening into the nasal cavity, and it's bounded medially by the septum and laterally by the ala nasi. And speaking of, the ala are lateral cartilaginous wings. Next, we have the skeletal structure. It's made of multiple bony and cartilaginous components. Now, the bony components, they're superior, and they're the nasal bone and maxilla. For the cartilaginous components, we have the septal cartilage, two lateral cartilages, two major alar cartilages, and some minor alar cartilages, 6 to 8. It's not important. Now, onto the vessels and lymphatics. So the maxillary and the ophthalmic arteries, they're the major arteries of the external nose. The maxillary leads to the infraorbital artery, right here, and the ophthalmic leads to the dorsal and external artery. Here's the dorsal, and here's the external. Now, the septal and alar cartilages, they're innervated. They have angular and lateral nasal arteries, which are derived from the facial artery, which come from the external carotid. And for venous drainage, it starts at the facial vein and leads into the internal jugular vein. And lymphatic drainage, it accompanies the facial vein and drains into the deep cervical lymph nodes of the neck, like most lymphatic vessels in the superior region. Now for the innervation, the sensory innervation is derived from the trigeminal nerve. You're going to see all these are branches of the trigeminal nerve. The external nasal nerve is a branch of the ophthalmic nerve and supplies the dorsum of the nose, nasal ali, and nasal vestibule. Laterally supplied by the infraorbital nerve, a branch of the maxillary nerve. Now onto the nasal cavity. So nasal cavity has three divisions. First is the vestibule, which is just the area surrounding the opening of the nasal cavity. Then you have the respiratory region. It's the largest region of the nasal cavity. It's lined with a pseudostratified columnar epithelium with goblet cells, and contain all the concha and meatus. It's responsible for the passage of airway. So for the olfactory region, it's located at the apex superiorly, and is lined by olfactory cells and nerves and receptors. It's basically the main area for smell. Now onto the concha and meatus. So the concha, they're curved projections of bones from the lateral walls of the nasal cavity, and they create pathways for air to flow, called meatuses. Now these function to improve surface area, and it allows the nasal cavity to be humidified even further. Now there are three pairs of concha and meatuses. There's superior, middle, and inferior. You can see them right here. Now, many sinuses and ducts open into these nasal cavities, into the nasal cavity by the meatuses. First, we have the posterior ethmoidal sinus. It happens at the level of the superior meatus. You have the middle meatus. Now, this meatus has most of the sinuses. So, if you see a question that asks which meatus this sinus comes from, it's most likely going to be the middle meatus. And it has the frontal, maxillary, and anterior ethmoidal sinuses. And it's marked by a crescent-shaped groove on the lateral wall. Now here you can see the semilunar hiatus, the crescent-shaped groove. that's going to be your main point. Now, for the inferior meatus, it has the nasolacrimal duct, which is where your tears drain from your eyes into your nose, and the Eustachian tube, which is at the level of the inferior meatus, and it allows for equilibrium between the middle ear and just the nasal cavity. It allows atmospheric pressure equilibrium. And finally, we have the ethmoidal bulla, which is has the middle ethmoid sinus. Now onto the vasculature. It's pretty long, but inshallah it goes well. We have the internal carotid branches. They have the internal ethmoidal artery and the posterior ethmoidal artery right here. The ethmoidal arteries are branches of the ophthalmic arteries, and we have the external carotid branches, which have the sphenopalatine artery, greater-palatine artery, superior labial artery, lateral nasal arteries, and these arteries form anastomosis with each other. It's prevalent in the anterior portion of the nose, right here. And the veins of the nose tend to follow the arteries. They drain into the pterygoid plexus. That's facial vein or cavernous sinus. Now, this is pretty dense, but just make sure to revise it, and inshallah everything will be good. Next, we have innervation. Now, this can be divided into special and general innervation. The special innervation is for smell, which has the olfactory nerves. It's where the olfactory area is. And next we have general sensory, which is innervation to the septum and lateral walls. It's derived from the nasopalatine nerve, which is a branch of the maxillary nerve, and the nasociliary nerve, branch of the ophthalmic nerve. And innervation to the external skin of the nose is supplied by the trigeminal nerve. Okay, next clinical relevance. We have the spread of infection. Now, the Eustachian tube, it connects to the middle ear, so if something in the respiratory tract got infected, it would spread to the ear and cause swelling in the mucous linings, which can cause diminished hearing. And next we have epistaxis, which is basically a nosebleed. It occurs, it's pretty common, and occurs in the anterior third of the nose, which is known as the causal back area. And it could be local or systemic. It's pretty simple. Now, a question. A 54-year-old man is admitted to the hospital with severe pain in his nasal cavity. Radiographic examination reveals a carcinoma in his nasal cavity. In which of the following locations would the carcinoma block the hiatus of the maxillary sinus? I'm going to give you guys a second here. Now, we said that the maxillary sinus, most sinuses are located in the middle meatus, but just to make sure, we'll go back and check. Here we see the middle meatus has the frontal, maxillary, and anterior ethmoidal sinuses. So yes, the answer is the middle meatus. Now next, onto the larynx. So the larynx, it's a cartilaginous structure around your neck. It's basically your voice box. It guards the passage to the trachea in the bronchial tree, has three basic functions. Air passage, a sphincter, which allows air to go inside and doesn't allow food to go in. And you have phonation, which is the voice box, like I said. That's basically it. And for the sphincter, it helps. It's important for functions such as coughing and sneezing, vomiting, all that. Now, the anatomical structure. This like whole part is really dense. Just the larynx in general. So bear with me. The larynx is formed by a cartilaginous skeleton held together by ligaments and laryngeal muscles. Anatomically, the internal cavity of the larynx can be divided into three sections: the supraglottis, the glottis, and subglottis. Now, the supraglottis, it just has its false vocal cords. It's not a big deal. You won't get many questions about this page in tests, but just for sake of completion, I'm doing this. Next, the glottis, the most important part, it has the vocal cords, and the opening between the vocal cords is called the rima glottidis, and the size of the size of it alters the muscles of phonation. And we have the subglottis, the most inferior part. It's not a big deal. Now onto the cartilages. We have the principal cartilages, which are made of hyaline cartilage. We have the thyroid cartilage, cricoid cartilage, and retinoid cartilage. And these can calcify with age. Next, we have the secondary cartilages, which are made from fibroelastic cartilage. They're the epiglottis, corniculate cartilage, and cuneiform cartilage, and they don't calcify. Here you can see the thyroid, cricoid, and retinoid cartilages, and epiglottis, cuneiform, and corniculate. Now onto the muscles. This is where it gets really memorizing, I guess. And you have the extrinsic muscles. They join cartilages to neighboring structures in the neck. And they're divided into suprahyoid and infrahyoid, which are elevators and depressors of the larynx. And next we have intrinsic muscles. They regulate length and tension in the vocal cords. They're basically responsible for how you speak, the tone of your voice. And they're supplied by cranial nerve 11 by the 10th vagus nerve, external and recurrent laryngeal nerves. So onto the extrinsic muscles. We have the elevators, the digastric, stylohyoid, geniohyoid. Now this is pretty complicated. You're gonna have to memorize basically everything, though it's very rare that you get a specific question about something. You're just gonna have to bear with me and memorize everything. You have the suprahyoid muscles, the elevators, the digastric, stylohyoid, geniohyoid, the stylopharyngeus, and palatopharyngeus. Next, we have the depressors of the larynx. We have the sternothyroid, sternohyoid, omohyoid. They're all infrahyoid muscles. Now, ansa cervicalis is basically just a nerve. Be sure to memorize it. And we have the thyrohyoid and the inferior pharyngeal constrictor. Next, we have the intrinsic muscles. For the muscles varying the aperture of the glottis, the abductors, we have the posterior cricoarytenoid, the adductors, lateral cricoarytenoid, transverse arytenoid, oblique arytenoid. For the muscles regulating tensions of vocal ligaments, we have the cricothyroid, thyroarytenoid, vocalis, posterior cricoarytenoid. And for the muscles modifying the laryngeal inlet, you have the aryepiglottis, oblique arytenoid, thyroepiglottis, and thyroarytenoid. Now, it seems complicated, but all these muscles, they're named after where they connect. So the cricoarytenoid, it connects to the cricoid cartilage and arytenoid cartilage. If you can try to relate it, then hopefully it'll be easier for you. Now here you can see all the muscles. Here you have the extrinsic, and here you have the intrinsic. Now for the vasculature and innervation, we have the blood supply. It's supplied by the superior and inferior laryngeal arteries. You can see here a superior and inferior. From the superior thyroid artery comes the external carotid artery, and from the inferior thyroid artery comes from the thyrocervical trunk, which is subclavian artery. Now the nerve supply, it's mostly branches of the vagus nerve. You have the internal and external laryngeal from the superior laryngeal nerve, and you have the recurrent laryngeal nerve. You can divide into motor innervation, sensory innervation, and autonomic innervation, which comes from sympathetic and parasympathetic. Now onto motor innervation. It's all intrinsic muscles supplied by branches of the vagus nerve. External laryngeal nerve is a branch of the superior laryngeal nerve from vagus to the cricothyroid muscle. The recurrent laryngeal nerve leads to all remaining intrinsic muscles. This is important. Make sure to memorize it. Now, sensory innervation above vocal folds, internal laryngeal nerve. It's a sensory branch of superior laryngeal nerve. And below the vocal folds, we have leads to the recurrent laryngeal nerve. Okay, on to the trachea and bronchial tree. This is the last section, hopefully, and it's easier than the larynx. Now, onto the anatomical position of the trachea. The trachea marks the beginning of the tracheobronchial tree. It arises at the lower border of the cricoid cartilage. Most of you know it's a continuation of the larynx. It travels inferiorly into the superior mediastinum and bifurcates at a sternal angle. This is important. At the second rib, at T4 to T5, and it forms the right and left main bronchi, as well as the carina, which projects up and can be seen via bronchoscopy. Now the trachea is held open by C-shaped cartilage rings in order to not constrict esophagus and other structures posterior to it. And they're supported by the trachealis muscle. Now onto the structure of the bronchi. At the level of the sternal angle, we said the trachea bifurcates right and left main bronchi, and they undergo further branching to secondary bronchi. Now each secondary bronchi supplies a lobe of the lung and gives rise to several segmental bronchi. Now, along with branches of the pulmonary artery and veins, the main bronchi make up the roots of the lungs, which is the hilum of the lungs. The right principal bronchus is shorter and wider, which allows for more objects to lodge inside it. It's basically more common for objects to lodge inside the right bronchus than the left because of how wide and how much shorter it is. Now, each secondary bronchi supplies a lobe of the lung. We said that. There are 3 right lobar bronchi and 2 left. The lobar bronchi bifurcate into several segmental bronchi, each of which supplies a bronchopulmonary segment. Now, the bronchopulmonary segments are subdivisions of the lung lobes and act as a functional unit of the lungs. Onto the bronchioles and alveoli. Now, segmental bronchioles undergo further branching to form numerous smaller airways called the bronchioles, and they're the smallest airways. They don't have any cartilage. And they eventually end as terminal bronchioles, and these bronchioles branch even further into respiratory bronchioles, which have alveoli extending from their lumens. Now, alveoli, right here, they are tiny air-filled pockets with thin walls. They are where gas exchange happens. You have the pulmonary capillaries around them, and altogether they exchange air, and there are around 300 million alveoli in adult lungs, which provides a large surface area for gas exchange. Now onto the neurovascular supply. The trachea receives sensory innervation from the recurrent laryngeal nerve. The arterial supply comes from the tracheal branch to the inferior thyroid artery, while venous drainage is via the brachiocephalic azygos and accessory hemiazygos vein. The bronchial tree, the bronchi derive innervation from pulmonary branches of the vagus nerve, and blood supply to the bronchi is from branches of the bronchial arteries, while venous drainage is into the bronchial veins. Now that'll be all. Thank you very much. I know it's a pretty dense lecture, lots of information, but inshallah, with enough practice, everything will be good, and you'll do good on your tests, inshallah. Thank you so much.